Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. In this video, I want to finally start talking about late side effects for cancer treatments. This video in particular may be a little bit long, so I may have to go to a part 2 because I'm going to discuss one of my major late side effects that I had to deal with. But what I wanted to stress is that though not everyone develops these late side effects, and really it doesn't matter what type of cancer you may be dealing with, I'm speaking specifically from my experience as a Hodgkin's lymphoma survivor. But clearly many of the treatments for various other cancers are the same, whether it's radiation, perhaps a particular chemotherapy drug, but not everyone is going to develop these late side effects. But as we've found out over the decades, I'm 37 years out now, more people experience them than what they thought. And the problem was, back in my day of being treated and those that were treated before me, we weren't warned about the likelihood of these things happening. Some claim they didn't know, perhaps some did. But the majority of us long-term survivors had no idea what was, ahead of us. In particular, my first late side effect that I became aware of, again, not diagnosed, but that I became aware of, occurred 18 years after I completed treatments. Those 18 years, I wasn't followed up for any potential side effects. My oncologist never warned me about any because, according to the documentation that I had 2 things to watch out for: possible enlargement of the heart and a secondary type cancer. Through those 18 years, I didn't have any that I was aware of. You also have to understand that there are things that weren't done for us back in the 20th century. So going back, it may have gone a little bit into the 2000s, but more likely in the 1990s, the 1980s, 70s, and 60s, definitely, we weren't protected, especially when it came to radiation treatments. Whereas today, when you lay down on that table, if you're getting radiation therapy, they do a lot better job of protecting areas that don't need to be hit with radiation. You notice that whenever you get an x-ray or if you go through treatment, the technicians leave the room, because they can't be exposed to that radiation. Well, if you're a patient laying on that table, normally, at least back in my day, and again, speaking from my own experience, I was treated with what was called upper mantle radiation. Upper mantle basically meant from the mid of my abdomen up to my jaw here. And because it was called scattered field, because of the screen, I need to start here, okay? It covered this area. So on each outer side of my shoulders. So you have this boxed area getting hit with all of the radiation. Now, in the 21st century, doctors learned that they don't need to radiate the entire area anymore. So they are more fine-tuned with lymph nodes that they need to hit, or a particular body organ that needs to get radiation without affecting anything else. And to protect you, I don't know how many of you do it, they put a shield over your face. They make a mesh shield that gets put over your face, likely also over your neck, depending on what has to be treated. And you get treated wearing this mask. You may also have lead blocks to protect the heart, the spine, other things like that. In 1988, I didn't have any of that stuff. But I also never got any of the warnings because they didn't know. So I have a long list of late side effects that I deal with. But at the very top of the list, and the one that gets the most attention, is the heart. Now, there are, regardless if it's radiation or chemotherapy, you have reason to keep an eye on your heart. That means when you're done seeing your oncologist, you keep in touch with your primary care doctor. You let them know what you were treated with. Your oncologist should give you paperwork to give to your primary care, surveillance to keep an eye out. Do a baseline, you get checked out. If everything's fine, we'll see you in whatever they recommend, 4 or 5 years. But if they notice that something is wrong, they need to keep a closer eye on you. My cardiologist, when he saw me in April of 2008, told me I was one of the luckiest people on the planet. Because though I had symptoms, and by symptoms, I had a major chest tightness in the left side of my chest that would occur whenever I would start any kind of strenuous activity, whether it was at work, whether it was mowing my lawn. For the first 30 seconds to a minute, I would have this tight, almost felt like what is commonly described as a side sticker. But then that pain would go away and I would just go about my business. Now, in the gym, I would be on the elliptical machine and I would just watch my pulse skyrocket in under a minute, up to at least 150 or higher. I got tired of feeling that way and I called up my family doctor and I described the feeling to her. And she had set me up for a nuclear stress test. I was only 42 years old back then. So it was very unusual to have somebody get that kind of test. Within 36 hours later, I was on a table having emergency open heart surgery, a bypass. And I'm going to say it was supposed to be a triple bypass, but for some reason the doctors didn't feel the need once they were in there to do the third one, which was a mistake, and I'll get into that shortly. They only did a double bypass. I'm not going to go into all the details of what happened with that. I'll make a separate video for that because I want to get all this information out to you that I possibly can, and it's going to be hard enough going into 2 videos with this. But I had the bypass surgery, and it's at that point that they realized that I was dealing with radiation damage, even though it was 18 years earlier. Progressively, over time, radiation continued to cause damage to my cardiac system. Us survivors have a habit of calling radiation the gift that keeps on giving. And as I eventually go through other side effects that I have to deal with, you'll see why. So there are a number of tests that can be done. Again, it's regardless if you are dealing with radiation or chemotherapy. I went through, there are 2 drugs that were on the lookout for Hodgkin's, adriamycin. Many of you may recognize that as the Red Devil, and also bleomycin. Now, adriamycin is not just used for Hodgkin's patients, but pay attention to me. It's also used on breast cancer patients. And adriamycin, though it's a very powerful and good drug for treating cancer, it can also be problematic and it needs to be watched. So you get your test, simple EKG, an echo. If you're symptomatic or things appear unusual, you may end up having to go through a stress test, perhaps maybe going through a catheterization, CAT scan or MRI, any number of heart tests to get at least a minimum baseline. And if there is something wrong, that the doctors can, that your primary care doctor can refer you to a specialist better capable of handling that. I'm going to cut this video off right now, and I'm going to jump over to doing part 2, where I get into a lot more details of things you need to know. Again, please watch video number 2.